CT, MRI, tissue biopsy, and eventually a day procedure in the operating room called a cervical mediastinoscopy. This is a procedure where a small incision is made at the base of the neck and mediastinal lymph nodes are biopsied. We now know that if the mediastinal nodes are negative for cancer, meaning no cancer is present, that these patients live longer than if the nodes are involved with cancer. If we suspect the possibility of mesothelioma existing in the abdomen, we may perform a laparoscopy to assess. This involves going to the operating room where a small incision and cameras are used to obtain tissue to prove the presence or not of mesothelioma in the abdomen. There are two operations that thoracic surgeons may consider performing for patients with mesothelioma. These are named pleurectomy and decortication or extrapleural pneumonectomy. Pleurectomy and decortication is a surgical procedure that involves removing both the visceral and parietal pleura. This leaves the lung in place. This can be a potential option for patients with very minimal or very advanced disease. An extrapleural pneumonectomy is the complete removal of the lung with its visceral pleura, the parietal pleura, the diaphragm, and the sac around the heart, termed the pericardium. We then reconstruct both the pericardium as well as the diaphragm using prosthetic material. We believe extrapleural pneumonectomy to be the better choice for people who are strong, are younger, or who have more bulky disease. There is no gold standard therapy for mesothelioma. Your treatment plan depends on the anatomy of your tumor and your overall status. Sometimes chemotherapy is done before surgery. Our thoracic group from Swedish has a recent publication describing our treatment philosophy and results in patients with mesothelioma treated with chemotherapy first, followed by surgery and then radiation. Patients with mesothelioma are better managed in centers where there is experience in treating this type of cancer, as well as with the complex surgical procedures required for removal of the entire tumor. Only by centralizing the care for the small number of new patients with mesothelioma seen every year to a limited number of medical centers can we continue to study, learn, and improve outcomes for our patients fighting this cancer. In the past, mesothelioma was considered to be a disease that could not be treated, in which only pain management should be offered. We have come a long way from those days. We now know there are interventions that can help certain patients live longer and more comfortably. The surgeries that we offer to patients have improved our ability to make accurate diagnoses before we head to the operating room. We continue to experiment, do research, and study our results critically. Thank you for listening to the Plugged Into Your Health Cancer Podcast program, Mesothelioma and Malignant Pleural Issues in Thoracic Surgeries. For more information, please contact your thoracic surgeon.